Great. Hi, everyone. Welcome. We are so glad to have you with us here today. My name is Justin King. I'm the Associate Director in the Aspen Institute Financial Security Program, or FSP, and I want to thank you for joining us for today's event. Stress test, people, technology, and the safety net in response to COVID-19. Today's event is part of a series that's being held by Aspen FSP. The series is called Conversations in Financial Security in Response to COVID-19, How to Triage, Recover, and Stabilize. Mark your calendars, as each Wednesday at 1 p.m. Eastern for the next several weeks, we're going to host conversations on critical issues in financial security: housing, consumer debt, student loans, cash infusions and guaranteed income, emergency and retirement savings. Events in the series are going to feature key leaders and real experts on the issues. Next week's event is on housing and will feature former HUD Secretary Julian Castro. I should note our work on the safety net is part of the Aspen Partnership for an Inclusive Economy, an initiative that's made possible by anchor funding from the MasterCard Center for Inclusive Growth. I want to thank the MasterCard Center for Inclusive Growth for their support and partnership. It means a great deal to us. A few housekeeping notes for our viewers today. You can ask questions and discuss the conversation with other viewers of the webinar using the chat function. Our team is going to be monitoring that channel and helping me ask questions of our panelists. You can also participate via Twitter. You can tweet questions to our organizational handle at AspenFSP. You can also use the hashtag AspenFSPLive, and we'll do our best to get your questions to our speakers. The conversation is being recorded and will be available afterwards on our website. Thanks again for joining us, and we're going to get down to business. For our purposes, we in Aspen FSP define the safety net as the suite of federal programs that are intended to alleviate poverty and improve the financial security of individuals with low incomes and their families. Key examples that you're going to hear about today include SNAP, the Nutrition Assistance Program, formerly known as food stamps; TANF, the block grant that replaced the cash assistance entitlement that we used to call simply welfare; the Earned Income Tax Credit, or EITC; unemployment insurance, or UI; and of course there's a host of other programs that support people either as they can't work or as they work for wages that are too low to allow them to adequately support themselves and their family. It's critical, I think, to lay down a few facts about the safety net that really shape our perception in Aspen FSP. First, combined with wage income, the safety net really does remove people from poverty. Without the safety net, the poverty rate would be about 25%. But including transfers from the safety net, that rate gets cut in half to just under 13%, at least just under 13% prior to the impacts of COVID-19 on American households. Second, workers use the safety net. A 2018 analysis by economists Diane Whitmore-Schanzenbach and Hilary Hoynes concluded that virtually all gains in spending on the social safety net for children since 1990 have gone to families with earnings and to families with income above the poverty line. And the third thing I want to share as sort of a foundational plank is that the safety net inflicts costs on its users. Public benefits come with qualifications or limits that force people to make decisions that might not be in their near or long-term best interest, and balancing that is really challenging. Sometimes workers have to forego raises in order to maintain essential benefits for their household, or states enact limits on savings that a person can have and still be eligible for a program, preventing them from having savings that would be really valuable in, say, paying your rent when your income is decimated by a stay-at-home order. There's also real time and mental costs associated with applying for and maintaining benefits. And there's a great deal of confusion about who's eligible to apply and how. And right now, we've seen an incredible stress test being applied as millions of workers have flooded state systems seeking support. What we found too often is that the technological infrastructure that delivers the policy And I would also argue the policies themselves that make up the safety net are not ready for this moment. As one extreme example, you can look at Florida's struggles to deliver unemployment insurance. It's been in the headlines quite a bit recently. Basically, the website has crashed. The state required applicants to use paper forms and line up to acquire those forms. They've attempted to erect a new website with really limited success. As of earlier this week, just 17% of approved applicants had received payments, and only 30% of recent claims had been processed. Those troubles are extreme, but they're not unique. A new study that came out yesterday from the Economic Policy Institute found nationally that for every 10 people who said they successfully filed for jobless benefits, the last 4 weeks, 3 to 4 more people tried to apply but couldn't get through. And 2 additional people didn't try because it was too hard. So policymakers in DC have moved with relative speed to make some adjustments to the safety net. But I think the nation's getting an object lesson right now that implementation is policy. It makes no difference to a person if the law says UI benefits go up by $600 a week, if that person finds it impossible to apply for and receive benefits. So we want your engagement today through the chat, through Twitter, and I'm gonna pop quiz you a little bit here. We have a poll question coming your way. And here's our first poll question for our audience today. Tell us a little bit about you, and we promise this will stay anonymous. In the past 5 years, have you written publicly about, performed research on, or done policy work related to the safety net? I'm going to give folks a few seconds to answer this incisive and probing poll question the best minds at the Aspen Institute came up with. In the past 5 years, have you written publicly about, performed research on, or done policy work related to the safety net? I'm going to share the results here. This is pretty remarkable, though you might consider typical given the audience that tunes into Aspen Institute webinars. Just under 60% of our audience is affirming that they have worked on the safety net or around the safety net from a policy perspective in the past 5 years. Now, here's our second poll question for today. In the past 5 years, have you applied for or received benefits from the safety net? And again, we'll give folks a little time to answer this question and share a little bit of information about themselves so we can know a little bit about our audience today. In the past 5 years, have you applied for or received benefits from the safety net? All right, I see the numbers climbing. This is really great. Excellent. All right, I see what looks like stability setting in on the voting percentage. And I think, you know, what you can see there is pretty typical, frankly, for what you would expect in a Washington, D.C. audience, right? And I think more broadly, you can intuit from those results that the people who make policy are often not really familiar with what it's like to use the policy. And you know, the flip side of that coin is that people who have direct experience in using safety net systems usually don't have a seat at the table when policy making happens. Our view in FSP is that this needs to change. Ignoring the value and wisdom of people in need is how we end up with both 50-year-old programming languages and mainframes going up in flames when we need them the most. And it's also how we end up with modern systems that are built not to deliver benefits, but instead to keep people from acquiring them. But now we're facing a situation where tens of millions more Americans are scrambling for assistance from the safety net. Earlier this week, the Pew Research Center reported that 43% of US adults have lost a job or taken a cut in pay due to the outbreak. More than half of low-income adults say someone in their household has experienced job or pay loss. Those numbers are scary, but they obscure the reality that America's deep racial inequality is also on display. More than 60% of Hispanic adults say they or someone in their household has lost a job or pay. And we know that savings rates, the buffer that families are supposed to accumulate to carry them through rainy days, are much less prevalent among Black and Hispanic households than among white households. The need for accessible and accountable safety net services is greater than ever before. We need better technology, yes, but more than that, we need to understand and care about the needs of our vulnerable citizens so that we can effectively assist them. That's one of the reasons why we built the panel that we built today and built this event. I'm excited to have these folks here. We have 3 terrific leaders of organizations that are using technology to make access to the safety net easier. But more than that, their organizations are experts at listening to the voices of their users and then acting upon what they've heard to improve their services. And that approach can help us to build better policy. I want to note that each of these organizations is a social sector organization, not governmental. They work closely with and alongside government, but it's important to sort of identify correctly the role that they play in the ecosystem. And I also want to note that we'll touch on a number of safety net programs today, but I don't think in an hour we could do service to the entirety of the safety net. What I would note, though, is that there really are some common themes and common experiences that can be exported from one policy context to another policy context. And finally, I want to note that our speakers are extremely busy managing their teams, and they're doing the hard and necessary work of helping people who are struggling to meet basic needs. And so I just want to say thank you all for being here today. And without further ado, let me introduce them in person. Rose Afriye is here. Rose is Executive Director and co-founder of mRelief, a nonprofit based in Chicago. Hi, Rose, how are you today?
I'm doing great. Thank you so much, Justin, the entire team at Aspen, and also Lou and Trooper. It's so great to be on this call with all of you today.
Thank you. Hey, Rose, hold on one second. Let me introduce everybody quickly, and then we'll dig into mRelief. Trooper Sanders is here as well. Trooper is CEO of Benefits Data Trust, a nonprofit based in Philadelphia. Trooper, how are you?
Very well. Thank you for having me.
Great. And Lou Moore is here. And in the green room, Lou was silent, and we were scrambling to solve our technical issues. Lou, how are you doing today?
We got it all worked out. I'm great. Thanks for having me. Glad to be here.
Lou is interim co-CEO and chief technology officer of Code for America, a nonprofit based in San Francisco. And yes, Rose, thank you so much. Can you dig in? I want everybody to set the stage a little bit for what life was like for your organization, before COVID-19 set in. Who did you serve? How did you relate to government? What programs did you work on? Tell us a little bit about mRelief.
Absolutely. So mRelief is a nonprofit organization headquartered in the city of Chicago, and we have built an easy-to-use platform on web, on text messaging, and also on Voice for Americans to sign up for the SNAP program. SNAP is our core focus. I would say pre-COVID-19, SNAP was really the #1 thing that we were focusing on, and we were doing so at a scale of about 42 states, where we would help people find out if they qualify for the SNAP program in roughly 10 simple questions, which take less than 3 minutes to answer. One of the things that is our niche at mRelief, and it's an organization I co-founded with an amazing CTO, Genevieve Nielsen, is focusing on families who have trouble accessing the internet. We know that 29% of people who make under $30,000 a year do not have access to a smartphone in the US, and we have seen how inequity to access to the internet has become even more highlighted as students have to work from home. So a lot of what we think about at mRelief is how can we promote access, not just online, but offline, so that people can access government services through text messaging conversations that are automated, but also through a lot of the amazing organizations that exist across the safety net. Think Catholic Charities, Feeding America, who've been doing also this work for decades and who can also help people enroll. So I'll share a little bit more about that work today. But I think really it's been a huge push for us to scale beyond just the 42 states that we serve in the midst of COVID-19. And then also to really prepare our team for thinking beyond just the traditional SNAP program, but the many iterations that have come into play due to the new flexibilities that the states have provided.
Yeah. No, that is very real. Trooper, can you tell us a little bit about Benefits Data Trust and what life was like for you, what services BDT provided, where and how before all this kicked into high gear?
Yes, indeed. So thank you everyone for joining. Well, since 2005, Benefits Data Trust has been around, based in Philadelphia, but working across the country to really help people tap the benefits that they are eligible for, but are having a hard time getting. And we do that through a combination of developing and using data and technology, policy engagement, particularly at the state level, and helping state officials who are on a good day overburdened and understaffed tap some of the existing policy opportunities that can open up the arteries of benefit services so that more people can get them. And then really the heart of our organization is providing a high touch and quality direct service to people across the country so that they can call us, get screened for benefits. We help with the application process, and depending on the state and their rules, really drive it all the way through getting things to the agency so people can get the help they need as quickly as possible. And I'm so proud of my team for, since we've been founded, we've helped more than 1 million households access more than $7.5 billion in benefits. And I'm just so pleased that we are part of this ecosystem of extraordinary organizations such as the ones on this webinar.
Yeah, it's remarkable. It's a great opportunity, I think, for us to highlight that there's so much work that happens sort of outside of and in partnership with government. Lou, you guys at Code for America have a lot of experience doing that as well. Can you take 2 minutes and just tell folks a little bit about Code for America who might not be familiar?
Absolutely. So we're also a nonprofit. We partner with governments to improve the delivery of public services. We believe the government can work for the people, by the people in the digital age. To bring that vision to life, we use the principles and practices of the digital age to improve how government serves the American public and how the public improves government. Those principles and practices include user-centered design, iterative software delivery, data-driven decision-making with a laser focus on client outcomes at all times, and a multidisciplinary approach where we really believe that tech and policy need to be together at the table from the start. We think that with this approach, we can make government services that are simple, accessible, and easy to use, that outcomes can be measurably better, that better can actually cost less, and probably most importantly, that we can serve everyone with respect and dignity. That's why we've chosen to also start by serving the most vulnerable with a portfolio of work that's focused on shrinking the criminal justice system and expanding the social safety net. So our work in these areas gives us an opportunity to really understand and reduce the burden that people so often face and is so often compounded by hardship, preventing low-income Americans from meeting basic needs like you see here: food, healthcare, jobs, housing, and cash. So every project we take on is towards one of these ends. We operate Get Cal Fresh. It's a service that helps Californians keep SNAP benefits. We serve every county in the state and helped over 1 million people last year. Over the last few years, we've also expanded our safety net work through the Integrated Benefits Initiative. This is a project that was designed to sort of explore the challenges across safety net systems and ultimately to help us build a human-centered safety net across the country. So we've worked on a unified SNAP and Medicaid application that you see here in Michigan, built text messaging interventions for SNAP, Medicaid, WIC, and TANF in Louisiana, and more, with more to come. Our newest project, Get Your Refund, is focused on helping people get flexible cash by filing taxes and claiming credits, the most important of which is EITC, and we'll talk about how that program has changed here with COVID. Clear My Record is all about removing barriers to jobs, housing, and more that have been erected by an unjust criminal justice system. And then through our network of Code for America brigades across the country, we have projects like gethousing.org, which was done in Miami, that work towards these same outcomes at the local level.
That's great. Thank you, Trooper. Thank you, Lou. Trooper, you guys, like you said, you've been on the front lines. You've been trying to help people. I wonder if you can pull back the curtain for us a little bit and just, let us know what's changed and what the experience of that change has been like for you all.
Sure, and in some ways it's hard to imagine life before the COVID-19 pandemic, and what was seemed on fire then is just sort of pales in comparison. But I think there were a few things. First, we like many organizations had to turn ourselves into a 100% virtual workforce. And I'm especially proud that we were able to turn our contact center that works with people who need benefits right now in 6 states, with the help of our and flexibility of our extraordinary partners and supporters. We were able to turn that into a 100% virtual workplace in less than a week, so that we did not miss a beat in helping people as the demand for help increased. And then we had to change our the way we did our work. Traditionally, when we work with a state, say on SNAP outreach for seniors, we will do targeted outreach based on working with states and reach out to, say, their Medicaid population, but people who are on Medicaid who might not be on SNAP, as a way of focusing our resources and ensuring that the likely eligible are able to get through the system and get the benefits they need. Given the extraordinary tsunami of need out there, we adjusted that, and we are standing up hotlines in our states so that anyone who needs help can call and get screened, and then we can move people through the process. I think it's really a question, now and for this crisis, of use all tools and all hands on deck. Right. And then that leads us to the third piece of, and I love the work that's going on in Chicago, where we do have to remember, as much as we are using technology and web-based, that not everyone has access, and not everyone is comfortable transacting business that way. And so we are ramping up our tools in other ways to reach people.
That's great. Yeah, I mean, I think it's remarkable to sort of think, like, when we've seen a lot of talk about essential workers, that has focused a lot on, and rightfully so, on folks who provide healthcare and on folks who work at grocery stores and other essential services. But providing these services is absolutely essential at this moment in time. That's thank you for highlighting that. Lou, can you I know that this has hit you guys hard as well. Can you talk a little bit about, like, what response and recovery has looked like for you guys inside Code for America?
Yeah, absolutely. So, with COVID-19, we're providing immediate support to governments and helping deliver relief to clients in new ways too, both by expanding some of the existing projects that I mentioned earlier and through some new crisis response efforts. So I'll start with Get Cal Fresh. We're serving almost 10 times the usual number of clients in that service. So that just the need for SNAP is incredible right now. We're now accounting for 70% of all applications in the state of California. The majority of applicants that we're seeing are newly unemployed and vulnerable, and we'll share some of their stories later today. We're also using, leveraging those stories and the data that we're seeing to push for policy change, which we'll also get into a little bit. Get Your Refund has also changed really dramatically due to COVID-19. It's a fully digital tax assistance service in partnership with the IRS's Volunteer Income Tax Assistance Program. And we were originally set out to help people claim the EITC and other tax credits. And now with the stimulus, we have an opportunity to help even more people and really maximize the flexible cash people can get from tax filing, get more people into the get more people to become tax filers, which has been shown to have a reduction on long-term poverty rates as well. So we're now in the midst of scaling this service up from thousands to millions to meet that need. And we've taken on a couple of new projects. Pandemic EBT helps families with children eligible for free and reduced price lunch get a new benefit to help while schools are closed. 3.3 million kids eligible in California, and over half of those won't receive the benefit unless they have some new way to register. So we're building that to help that population. The goal is to support other states in adopting that as well, so we can reach more of the 30+ million kids nationally. Disaster Relief for Immigrants is another new program we announced in California just over a week ago. It's helping undocumented immigrants who are ineligible for other benefits with up to $1,000 cash assistance per household. Collaboration with the California Department of Social Services and immigration-focused CBOs in California with a super fast couple-week turnaround time. So the team had to really jump on this one quickly. And then across our brigades in 80 cities over the US, responding with a variety of projects from resource maps and directories, mutual aid efforts, tools and models for hospitals, and more. And the people power of the brigades out in our network is also part of how we're going to scale up our programs like Get Your Refund.
That's great. Yeah, no, that's remarkable. I mean, Trooper said all hands on deck, right? And I think what you can see in this slide and in your description there is, all hands on deck. People are desperate, I think, in a lot of ways to find ways that they can help, and there's a lot of different answers that are out there. I just want to highlight that, recognize that there must be tremendous challenges involved in dealing with a 10 times increase in volume in SNAP applications. And so thank you for taking on that task. I'm sure people have made sacrifices inside your organization to try and deliver that help. Rose, can you tell us, you guys have made some updates as well at mRelief. I think the first thing I noticed when this happened and we first connected is that you expanded really quickly and covered the states that you had not previously covered with your core service. Is that right?
Correct. So we worked with, in some cases, directly with state representatives to make sure that we could have the correct eligibility requirements, or in other cases, just local legal advocates, so that we could really empower people with the information on whether or not they were eligible for the SNAP program, and also really, really important alerts that could help them best navigate the SNAP program, whether they received it or they didn't. And so I think a big project that our entire technical team has led, so huge shout out to Genevieve, Maggie Rose, and Dizay on this amazing tool, is that to the government's credit, the FNS and the USDA has made a lot of information transparent on its public website. But I think one additional step is needed is to make that information accessible and actionable at the very time that someone is actually trying to apply and actually get those services. And so we created a tool that parses through all of this important data on the FNS website. And then we transform that data into accessible language that's integrated into our screening experience. So about 10% of our users already are receiving SNAP, for example, and they just want to know if they're still eligible. And so really being able to help people understand that you live in a state where recertification has been extended for 6 months, for example, or this is how much you're actually going to get, right? The idea that we have maximum allotment, but what does that really mean for someone who's actually just trying to get the benefit? And then also, when will I get my money, right? There's a lot of detailed guidance in the PDFs that are on the site. And so we have to combine not just programmatic tools, but also senior research expertise to make sure that we could make that language at a fifth grade reading level so that people could actually access it. And so that's been really, really important for us. That's coming this week. The other big thing that we've done, and yes, you're going the right direction, is Johnnie is a new tool that we've actually opened up. It was something that was internal to our organization. So first, I have to pay homage to who Johnnie Tillman is. She's an activist from the 1970s that was on the front lines of welfare advocacy in the US. And she's known for saying that there is no dignity in starvation. And our mission at mRelief, very similar to what Lou said. I'm so glad that you brought dignity into the room. It's to transform access to social services for the inherent dignity of all people, and to do so with recipient-centered leadership in mind. And so as we think about ways in which, and amplifying what Trooper said, that people may not have the preference that they want to do business in the way of going online, we basically opened up our CRM to help a lot of the traditional organizations that do field work on the Deep South Side, on the West Side, and a lot of the different neighborhoods throughout Chicago to really be able to do this work remote, right? Because it's one thing as a tech organization to really be able to bring your team to remote, and it's a completely different thing if literally no one on your team has ever worked remote. And so we've been iterating this pretty much weekly with a lot of their feedback, and are super excited that we're going to be matching both self-service, the ability to apply online, but also the ability to apply with someone's help that can walk you through this process at such a difficult point in our history.
Yeah, no, that is remarkable. I love the sort of like the speed with which people are moving. And again, that concept of all hands on deck, and there are essential workers here that include folks working for government agencies, and then also all manner of other social sector service organizations as well. Let's drill down a little bit into this, and let's talk about what you all have heard from people who are using the services that you're providing. Lou, you were very generous in sharing some of the user experience that you've captured through Code for America's different projects. Can you talk us through what folks have shared with you guys?
Yeah, my pleasure. So yeah, we engage with our clients really regularly in a number of different ways, starting with, we do a lot of extensive qualitative field research. From the start of any project, we have an amazing user research team, and it also extends to, user testing, surveys, and then live client support. And so, Justin, you mentioned the strain that must have on the team, having that kind of 10x traffic. We do run our own client support. We talk to folks through live chat every day, and our client support team's doing an amazing job. So this is a set of quotes from our Get CalFresh clients since the pandemic started, along with some sort of a quote that illustrates like a key theme that we're hearing. And so many of the clients are just we're hearing from are just dealing, with navigating the complexity of safety net services for the first time in extremely stressful situations. So the first theme is that people are seeking human interaction amid isolation and uncertainty they're feeling right now, and that isolation is really heightening their fear. So the first quote is, "My job that I worked part-time is closed due to coronavirus. My kids are home from school and I have no daycare for them. They are on the school lunch program, and it is a financial issue to provide what they need at this time."
Yeah.
Second theme here is that we're seeing, across a number of industries, folks like hairstylists, bartenders, artists, drivers, who have faced incredibly rapid loss of income, and in some cases a total loss of income. I'm an hourly wage employee. I'm in the hair industry. Due to the coronavirus pandemic, my workplace has reduced my hours to 3.5 hours. I have $54 to my name at the moment, and I'm struggling to purchase food for my son and me. A lot of our clients were working and managing their bills before the pandemic. Countless applicants today have no resources and need immediate support to meet even the most basic of needs. So another quote from I'm a restaurant server and rely on tips for my income. The city is on a coronavirus lockdown, shelter in place, and I have no income. I just don't know what to do. These are frightening and difficult times. I hope you and your family are safe. We're also seeing, again, an incredibly urgent need that's amplified by family circumstances. Another Get CalFresh client with this coronavirus and me out of work. Just desperation. No problem. I'm in desperate need. I'm just trying to feed my babies. And we'll go to the last one. The pandemic's also exacerbated existing housing challenges. So we're seeing a lot of quotes like this. Because of the coronavirus, I'm forced to stay home with my daughter. We lost our home and are staying in an RV. So that's just a sample on some of the key themes, and you'll see a lot of the policy recommendations we'll talk about later directly related to what we're hearing from folks. I encourage folks to go to a website that we did pre-pandemic called, it's at snapstories.codeforamerica.org. It's pre-pandemic stories, but I think it's got a large collection of similar kind of quotes from clients, and it's really important to underscore the challenges people face interacting with government services, even in normal circumstances.
Thanks, Lou. I mean, those are really powerful and really, frankly, like tough to navigate quotes, right? And it brings into light one of the most important things and one of the most challenging things, I think, for folks who are used to operating at the sort of national level right now, is that you can look at huge numbers, whether it's people who are dying, or people who are flooding unemployment insurance systems or SNAP systems, and maybe millions, whatever, but each and every one of those is a person with a story, and that story is really real and can be really painful, and none of those people is completely isolated, right? Each one of those people who's sharing those messages with you represents family and community that are suffering alongside them as well. So thank you very much for sharing that. That's really valuable for us. Rose, you talked about recipient-centered leadership. I wonder if you want to dig in for us a little bit about what that means at mRelief.
Yeah, and so I think for our work, and I think one thing that might be helpful is to share some numbers that we've served more than 600,000 families across the US, and also do quite a few pilots in depth to help people through the entire enrollment experience. But what we do, because we have an automated chatbot available, and also do all of our customer support in-house, we also do contract some of it out, but have a lot of messages that we hear from clients. And so a lot of what we do is proactive engagement with our clients. Every time someone signs up for mRelief, we get permission to re-engage them over text messaging. And so, for example, in each of the processes where the Federal Register had open comment last year, we sent letters on behalf of our clients based on compiled text messages that they had. And so that's one huge thing that we think a lot about in terms of surfacing user insight and experience for policy. And I think the other thing that I want to be able to do as we think about feedback is really remember how important these programs are at making the most challenging time in your life just a little bit better, right? And so this first user that I'm gonna raise, she talked about a woman at the LA call center named Kim, who did everything in her power to make her feel comfortable, to answer all of her questions and didn't make her feel less than, right? So when we talk about dignity, what does that actually mean in the context of an experience, right? That nobody ever walks away feeling less than because they need just a little bit of help, right? We also, the very last quote, she talks about the idea that, you know, she once tried to do this on her own and, you know, was sent paperwork to fill out and just gave up, right? That people do need to have interactive experiences where they don't feel completely isolated in the process. And I think that speaks to, you know, all the organizations on this call right now and the work that they do. And then there's, of course, another user that says we're the best institution in the US because we're saving people's lives. And I'll take that feedback too, but I think it speaks very specifically to this point that when you are able to provide food that people need to survive, yes, a pandemic has hit our country, and that is an imminent threat for many people. And every day before the pandemic and after the pandemic and during the pandemic, people need food to survive, right? And so I'm inspired by the words of the users that come to our platform and all of your platforms, and want to remind all of you that we're saving people's lives.
Trooper, can you talk about, you know, you talked about Benefits Data Trust as an organization that's really data driven, right? And, you know, I think one of the things I'm old enough to remember then when there was a movement in Washington, D.C. towards evidence-based policy, right? And which I think had a lot of good attached to it, but the thing I always thought when I looked at that was, well, people's lives and experience are evidence too, right? It doesn't need to just be sort of like big data numbers. Can you talk a little bit about what's come through at BDT?
Sure, and let me tie it back to how Rose ended about access to benefits such as SNAP and others are about saving people's lives, and these are life and death issues. Mm-hmm. And so one of the areas where we have done more analysis on it is really looking at what is the broader impact of benefits access on populations beyond, you know, addressing, say, the immediate hunger or food insecurity and other things. And one thing that we do know is that if you just take senior citizens and getting them access to SNAP, that will allow them, if they do go into the hospital, to have shorter stays, and it will also delay the entry into nursing homes by a material amount of time. And if we just think about this coronavirus pandemic, one of the greatest sources of mortality related to coronavirus is being in a care home. It's being in a nursing home, both in the United States and in other countries that have different types of healthcare and social systems. Mm-hmm. So making sure that someone is not only, you know, eating well or eating better, because of course SNAP only goes so far, and the other contributors to better health, better well-being, we know that can help save lives. And it is starkly apparent during a crisis such as this, where we have people in cities like where I'm from in Detroit who are dying from this condition because of other underlying conditions that are related to these social and economic and inequity related issues. And so, you know, we should be applying more data and more analytics, et cetera, but we need to make sure it's through the lens of the common sense human experience. And then the most important part is that we then need to take the lessons from that and apply them. And so, right, frankly, any argument going forward about whether we need to have a fully funded SNAP program and food security program should just look at the mortality rates in nursing homes. And, you know, we estimate $60 billion a year go unclaimed in benefits. Now, that's important in terms of economic stimulus and people buying food, but that's, you know, let's say that, you know, whatever percentage of that may be from SNAP, those are potential lives of elderly people that do not need to be at risk right now because of this pandemic, because they could be at home and sheltered in greater safety.
Thank you, Trooper. Let's stay with you for a minute. I mean, where do we take those messages and that data? Like, what is BDT looking at right now in terms of policy reform ideas that come from this experience? I mean, you just talked about SNAP funding, talked about some of the challenges of making connections between, you know, people who we think we know are eligible but are not taking up a variety of services that are available to them. What can we do about this?
Sure, absolutely. So we spend a lot of our time focusing on what are the ways of sort of operational policy, things that can make the benefit system more efficient, open up the application process, and making sure that we're taking full advantage of existing policy efforts. And so, for example, one of the coronavirus relief bills has allowed easier application processes for SNAP. And so that means right now, someone who is waiting for their unemployment to kick in can go and get SNAP and at least get food. There are other efforts where, for example, that makes it easier for people who are, say, on Medicaid to be able to apply for SNAP without going through a whole separate application process. But the important part is that the state has to apply to be able to do that. And often they don't have the time or resources or staff to do that. And so that's where our team can step in and help deal with things. And so we need to do everything we can possibly do to make the application process and the administrative process less burdensome. Frankly, I think we need to take a harder look at balancing. Yes, we're using taxpayer dollars. So we need to make sure that these programs are run well and run efficiently and run for people who are eligible for them. But if we are putting up barriers to reduce a 1 or 2% error rate, but blocking access for 20, 30, 40%, even more people. And again, going back to this pandemic, we know that those barriers are killing people. We need to make sure we're keeping this in the right proportion.
Thank you. That's really helpful. Rose, I know you guys have been concerned about you know, thinking about how to take voice of your users and what policy reforms would make their lives and your organization's life, frankly, easier. Do you want to walk us through some of what you think could help there?
Yeah, so a lot of what we talk about at mRelief for our long-term vision of what SNAP can look like is an opt-out world. So for some, and maybe not enough, of folks who got their stimulus, they literally just walked to their bank account and they saw the money in the bank, right? And the idea behind an opt-out world is that the government has enough authoritative and reliable sources of data that it really is unnecessary for people to have to file an application, to interview, and go through all the steps when they already have that information, right? That we should just be able to get our cards in the mail if we're eligible. And if, for example, we do not want to receive benefits, or we feel that this was an error, all we would need to do is just opt out of this benefit, right? And we see aspects of this in what's called the combined application assistance programs that allow for people who, for example, receive SSI to simply just get their SNAP card in the mail because they were able to verify that information. And we see many examples of this. We're in pretty advanced stages with an MOU with a city wherein every time someone registers for the wait list, we would just be able to apply that data to the SNAP application process and just ask if there are any additional questions, just the balance, right? And so I think really being able to have more data matching for the purposes of really being able to allow for people to meet their needs as fast as possible, as fast as the need exists, is a huge part of our long-term vision for policy. I think the other thing, as we think about, and I'm so glad that Code for America exists and has done so much work across sectors, but I think one of the biggest challenges that we see as we think of scale is the idea that the federal poverty level standard is different depending on what program we're talking about, right? And the income requirements, the documentation requirements, and what would it look like if we actually just adhere to one national federal poverty standard that required one set of documentation, because it shouldn't be the case that HUD thinks it's this, that healthcare thinks it's this, that you know, SNAP thinks it's that, right? That there should really just be one. So I think as we think about just elections and newer years of new leadership, these are some of the things that are top of mind. In the near term, though, we've thought a lot about how we can, again, bolster the organizations that have been doing this work for years. So community partner interviewers, for example, are really, really important flexibilities that many states have right now that we think can scale. So for example, there's a terrific organization in Florida called Second Harvest Central Florida. They have a 96% approval rate. It's people who live in your community who will walk you through the process and also interview you. And the state only has to take one last step, and that's send you the card, right? And finally, if you will, approve you. And I think more states should be giving flexibilities to everyday people, as long as they amass even just a modicum of expertise, to just be able to help people get signed up for SNAP and not just have backlogs and overwhelm really be this challenge that we're seeing across the US. More people can help with the interview process if they're empowered with these flexibilities. And then another thing that we see, I am excited that a lot of states have adopted telephonic signature and electronic signature, but they haven't adopted it for a lot of the organizations that do this work, right? And so what would it look like to explicitly across the USA that we can have electronic signature and telephonic signature? I know for us, for example, we've developed a really innovative way for people to be able to sign an application just through an automated voice call that reads you your rights and responsibilities, right? And I think it's additional administrative rules that would need to change to make that something that's just national for people who they can't fax an application or like scan an application and then email the application. Like they just need to be able to say like, this is who I am, take it and approve me, right? And then the final thing that I'm super, super excited about that I want to share some data on, I was speaking with a state director at the end of the fall, is about the potential of mobile EBT. So right now, you know, and I'll just share a little bit of my business. I just got new health insurance and they emailed me my card. I can book my appointments and I'm fine, right? Or, you know, if I lose my bank card tomorrow, they'll just send it to my cell phone. Like, why is it that the average person that's approved for SNAP has to wait 7 to 14 days on a plastic card to be able to access food, right? This should be something that is just instantly sent to your phone. Or, you know, in sub-Saharan Africa, there's amazing organizations across sub-Saharan Africa that have figured out texting money between two parties, right? Why isn't that the SOP, if you will, of the SNAP process? And, you know, in states, I know that there's one state that I spoke with, a pretty large state, where they do 110,000 cards that are issued every month. And 88,000 cards are replacement cards, right? So those folks are going without benefits for periods of time, all because they don't have their card in the mail. I think one of the biggest things that we can do for access, and it's written and printed in the last Farm Bill, is to have mobile EBT pervasive across the entire United States. And that would really help with the speed at which we're able to get people food in their pantries and in their fridges and to their families.
Thank you, Rose. That's really helpful. And I think, you know, the sort of like underpinning core there is not really about technology. It's about treating people who have needs and vulnerability as as though they were members of our society, right? And if that's a principle that can be adopted, then I think we can make a lot of technical advances at the same time. Lou, can I turn to you for a second, and can we talk through some of the lessons that Code for America has taken away and is looking to do this? And I hate to say this, I will note we are bumping up against time a little bit, and I want to make sure we have the opportunity to pull in some Q&A. So I don't want to squeeze you, Lou, but I just want you to know that people can see the slide, and maybe not every word needs to be read.
Yeah, no pressure. Cool. So early in the pandemic, we put together a set of policy recommendations kind of based on our long experience assisting clients and the insights we were getting from data on client stories in real time. And so these are, some of these have actually been implemented. But these are pretty specific, immediate policy recommendations that we came up with. So I'll say the first group is mostly about reducing burden and removing barriers, as you know, both Rose and Trooper spoke about so eloquently. And so it's just like the top denial reasons: interviews, additional verification, recertification, or reporting requirements that don't need to be happening right now. And then a couple more around long-term, you know, just radically streamlining applications across the country to lift administrative burden and providing more funding to move things online and to phones. And then also the last bucket down there is about, you know, once people are enrolled, utilizing SNAP is a really powerful tool to alleviate hardship. So utilizing EBT, more raising benefit levels, and expanding online purchasing pilots. Yeah. And then before I stop on this, we can go to just a couple more that on the EITC side. Yeah, so you know, we've also developed point of view on some tax policy from our work on Get Your Refund so far. You know, there are about 12 million non-filers, 9 million of whom now need to file if they're going to be able to access their economic impact payments. And you know, overall, our take is that tax prep is needed. Tax assistance is needed, and it should be free, trustworthy, clarifying, and accessible, especially for low-income households. So that's about, you know, improving current free options for low-income folks, continuing to facilitate digital methods for tax assistance that have been put in place in response to the pandemic. And you know, learning on the back of the economic impact payments, how we can facilitate more opportunities just to automate things, you know, help pre-fill taxes, and just reduce the burden of filing in general. So.
Yeah, it's remarkable to me. Thank you, Lou. It's really remarkable to see the extent to which, you know, so you know, my career has involved really the centered household economic security, but when I was a Senate staffer, I worked on TANF, and I worked on childcare, and then outside of that, I've done work, you know, both work that's programmatic and tax side, right? And you know, getting money to people turns out, you know, in 2020 to be a stupidly hard thing, and it's a challenge, you know, whether the money is liquid cash or whether the money is in-kind benefit as it likes. And I really, I'm seeing a lot of echoes in this conversation of the conversation that I've participated in, just in terms of the economic impact payments, you know, getting money to the last, you know, I shouldn't call them the last, but to the 10% of Americans or the 20% of African Americans who don't have bank accounts, is way harder than it should be, especially since we're watching our, you know, Canadian neighbors just put money into the accounts they've mandated that people have had for 20 years. So that it's really interesting to me to see that echo there. I want to turn to our audience a little bit and bring them into the conversation. I also want to give folks a heads up. We're going to take a prerogative and go a couple minutes over the stated closing time of this. Because I don't want to lose these remarkable people, and I want to make sure that we have some audience involvement. So if you need to drop off as a viewer, please feel free to do so. And if you need to drop off as a participant, that's fine, but I will hunt you down. The first question from our audience is actually from someone that I know. There's a friend and colleague named Chad Smith at the Beck Center. Georgetown University here in Washington, D.C. The Beck Center has a social safety net benefits research project that they've been engaging with, and we have collaborated with them because we are both very interested in what's happening around technology, data, and the safety net. And so the first question is from Chad Smith at the Beck Center. As SNAP's online grocery pilots have begun picking up steam nationally, what positives and what challenges have you seen thus far? And I'm going to just roll the second part of this question into this and then throw it out to the three of you. What policies, incentives, or advocacy groups exist or should be engaged to ensure commonly found grocery retailers operating in low-income Black and Brown communities are enrolled as one of the participating vendors? I think that, you know, the question there is really, as we advanced, how do we center equity in this work and make sure that communities that have been marginalized and are vulnerable right now are served through advances in policy? I will let the three of you fight it out to see who goes first.
Well, I think there are a couple of things, and you know, it's the business side of policy. One, we need to make sure that particularly the more well-known and trusted brands in online grocery and delivery services are actually serving the communities that we are talking about. And you know, I can put some zip codes from Detroit into some well-known brands, and they are not served. The second part is really thinking through, you know, the reality is with, you know, some of the equity issues in retail, that many low-income communities, Black and Brown communities, are served by independent stores, you know, the party store, as we would say in Michigan, or the bodega, you know, in New York and elsewhere. And so we really need to think through both, you know, how these types of businesses can tap these programs, while we are also, you know, ensuring that there is the variety of food that is available as we're dealing with some of the broader retail challenges.
Rose, do you want to?
No, I amplifying what Trooper said. I think the other thing that I'm thinking a lot about is farmers markets and the importance that they have in our communities. And just, I think in tandem, what we want to try to do is accelerate the retailer approval systems. So not just sort of on the state side in terms of having the access. We know, you know, that the big retailers will pretty swiftly be able to do this, but also creating some flexibilities so that a lot of the institutions that are the heartbeat of economies that feed families can also benefit from these online flexibilities and online opportunities.
Yeah, that's great. Lou, you know, one of the things you've mentioned this, and it's been a theme for us a little bit. It is really one thing, and I think it's a good period, end of sentence, the extent to which organizations like yours listen to their users. I don't think we see that to the same extent inside government, right? And you know, I think I've done my fair share of cruising on the, state benefit application websites, and I think one of the things that really jumps out at me really consistently is, boy, if you're in one of those systems, it seems really hard to get help in sort of providing the right answer. And it also seems really hard to give feedback on whether it's a good experience or not. And I really would love if you could share with us, maybe everybody in turn, if there's one of your techniques that your organization uses to listen to users' needs that you would like to see elements of government adopt, whether that's legislatures or HHS, state HHS agencies. Where should we look first to get to start to build feedback loops so that people aren't just navigating without a map or recourse when they need to seek service?
Yeah, that's a great question. It's hard to pick one. So I think it's just critically important to be listening to
I'll give you two.
your clients throughout. Well, I think well, first I'll say, I mean, the core of the problem is like the incentives are not aligned around client outcomes, right? But I would say that probably the most important channel for us is live chat, being there to help, you know, immediately as people are trying to navigate the process. And then if I get to pick a second one, it's actually field research to make sure that what you're building from the start is actually going to address the user need.
That's great. Thank you. Rose?
I think cadence is super important, right? And so I think as we build tools, I think really being able to have these moments at each step of development where you're really getting feedback from, you know, our organization, we start with paper prototypes and then mock-ups, you know, because I think one of the things that we found is that, you know, someone won't feel too bad when they're like, listen, like, this sucks, this doesn't work, if you at least start to test ideas through paper prototypes. And so that's just something we've done from like the very beginning of our formation. Obviously, in-person user feedback isn't something that we can accommodate at this time, but I think still having a cadence, having standing meetings that you will at least allow for your organization to have to get out in front of users, I think is super important. And then at least internally at mRelief, we have a text from our user Slack thread, right? And while a lot of it is really, really awesome, you know, NPS score is this, like we're moving. Also, NPS scores are really important as well for organizations that are not technically selling, if you will, a singular product to have as well. So that's been helpful. But I think really being able to populate that Slack channel to see how things are going in real time is so important. And so I think that there are many different methods that folks can use. But I think as if you can get as close as possible to real-time interaction, and also just having a cadence of it being integrated into your process, I think that you're on the right track.
Trooper?
Yeah, I would agree with what they said. You know, because we have both, you know, our technology products and have a live contact center, we spend a lot of time making sure that the human quality improvement and monitoring systems are in place. And that includes, you know, getting, while our team can't ask people for feedback, any of our clients who calls, who wants to give feedback, and many times it's positive, is able to get it. And so, you know, I would say from a government point of view, it's really important, even with all the resource constraints and other things that folks are going to face, is to energize and empower the employees and the community-based people who are working with people. The social workers, the caseworkers, the others who are right there and drawing in, frankly, the open source intelligence that those networks of professionals have, you know, the nurses, the nursing assistants, others, and draw that in and look for the insights across, you know, that great qualitative data set to figure out how we can improve these systems.
That's great. I think we have reached the point where it is time for us to begin wrapping up. I know there is a great deal more here, but I'm excited to say that for my part, you know, what you all have talked about and touched on today, I think forms a significant portion of the kind of work that's facing me and my program ahead. So let me say, first of all, thank you all for the work that you're doing. And thank you all for taking the time to share it and to share your user's voice with us and the audience today. For me, it was extraordinarily valuable. So thanks, everyone. I also want to say thank you to our sponsors at the MasterCard Center for Inclusive Growth. Again, their support of the Aspen Partnership for an Inclusive Economy and Aspen FSP made this event and this work possible. So thank you very much. I do have a brief reminder here from Rose that all of our speakers today are from social sector nonprofit organizations that do good in the community, and that means that you as an individual or as an organization might consider ways that you can sponsor them and help them unlock benefit in the communities in which they work. Also a reminder that next week we're back at 1 p.m. on Wednesday for the State of Housing. and each Wednesday at 1 p.m. Eastern for the forthcoming weeks. My team will be here with great experts tackling key topics. And thank you all very much. We'll look forward to seeing you again soon.